Good day. My name is Soni Boito, and I am here to present a talk on the basic MRI overview for conventional radiographers. And I first want to thank the organizers of this meeting for inviting me to provide this talk. And so an overview of our talk, we will take a look at how MRI uses three energy fields. Then we'll talk about the steps needed to create an MR image and some basics of MRI safety. Then we'll look at the two relaxation processes that are critical to creating image contrast in MRI. And we'll take a look at intrinsic parameters that are inherent to our patient versus the extrinsic parameters, which are the parameters we as the technologist and radiographer adjust. And that will give us a varied image weighting based on our image contrast. So let's dig in and talk about the three energy fields used in creating an MR image. It's a little bit different than X-ray, right? With an X-ray, we have one source, one energy source. And of course, that X-ray beam goes to our patient and it's attenuated, and then whatever transmits through or scatters through and hits the image receptor provides us with our image. And of course, we have the various areas where there's absorption, which will show up as areas of white on our image, and where there's areas of high transmission, it'll show up very dark. So again, there's just one energy source in radiography, whereas in magnetic resonance, there's actually three different energy fields that are at play. So the first is the magnet that gives us the magnetic and magnetic resonance imaging. We sometimes refer to that in the literature and scientifically as the B sub 0 or B naught field. It is measured as Tesla or Gauss. And to give you some perspective, 1 Tesla is equivalent to 10,000 Gauss. And 10,000 Gauss, well, that still doesn't necessarily mean a whole lot to us, right? So let's think about a magnet, a small magnet that you might find that holds up something on your refrigerator, maybe a piece of artwork from your children. That's very common here in my country, that we would use a magnet to hold up our kids' art. And those magnets are typically going to have a field strength of about 200 or 300 Gauss. Okay, so that gives you a little more perspective when you consider that many MRI systems, most commonly, they're operating at 1.5 Tesla or 15,000 Gauss. Now, of course, there are lower field systems as well, and they might be, say, 0.2 Tesla. And so you could do the calculation to determine how many Gauss that system is working with. All right, so that's our first energy field, is our main magnet, or our B0 field. Next is the radio frequency field. So we're essentially, when we place our patient into our scanner, we're creating a magnetic field in their body. However, our computer system can't distinguish the main magnet from our patient's magnetism. So to do that, to distinguish that, we need the radio frequency fields to be introduced. And so this is going to be energy that is found on the electromagnetic spectrum. It's going to be generated by the hardware of our equipment. And we measure that in hertz, or the number of cycles that pass by, the number of waves that pass by a given point per second. And we might identify this as our B sub 1 field. So we need our main magnet and we need our radio frequencies. Our radio frequencies are what are going to bring the resonance into magnetic resonance imaging. And then our third energy field or fields is going to be what we call our gradient fields, or time varying magnetic fields. These fields change strength over time, okay? So, and also over distance. And so we measure those as millitesla per meter, the change in magnetic field strength per meter, okay? And that's rapidly changing. And the purpose of our gradients is to allow us to locate where our patient is in our system, okay? So the main magnetic field is creating a magnetic field in our patient's body. The radio frequency field is allowing us to resonate that field and distinguish it from the main magnetic field. And then the gradients are what allow us to locate where our patient is in the system. All right, so a little bit more. So of course, we place our patient, a little bit more of an overview on creating the MR image. So of course, we place our patient into that main magnetic field or B0 field, and that's going to cause the hydrogen in our patient to align with that magnetic field. So if you think about the human body, it has an abundance of hydrogen, right? We're about 80, maybe 85% water. Then we have lipids and proteins, and so there is an abundance of hydrogen present in our body. And the good news is that we can use that to create our MRI images. Another thing that begins to happen is something called precession. So if you've ever seen a child's spin top, right, where it spins around and around and around, and then after a while gravity takes over and it also begins to wobble. That wobble, that actually is happening with our hydrogen nuclei in all of the hydrogen atoms in our body. So right now, wherever you're sitting or standing or watching this video, your hydrogen protons are spinning like a top. But if we put you into a B0 field, they would also precess. The magnetic field would actually pull on that spin a bit and cause a secondary motion or a wobbling that we call precession. And the great news is that that is a very predictable rate. And so we can determine the rate that the hydrogen precesses at with a very simple calculation. We take our magnetic field strength times a constant that's called the gyromagnetic ratio, and then that gives us the resonant frequency. Okay, and so that's really important because, as I mentioned, we need that activation of the radio frequencies and our gradients. So the radio frequencies are going to allow us to distinguish the patient as a magnet separate from the B0 field and give us a signal back to our computer system. And also the gradient activations are going to, again, help us locate where our patient is within the system. So there's a few steps involved to that. We call that a pulse sequence. So we're activating the computer system once we have set up our sequence with all of the parameters, the extrinsic parameters that we'll take a look at in a moment. Once we've got those all set up, then the system knows when to activate the radio frequencies and when to activate the gradients to perform various tasks that we need to get a signal that can be sampled and create the MR image. So that gets a little complex. So it's beyond the scope of our introduction here, but just know we're working with those three energy fields: the B0 field, or our main magnet, the radio frequency fields, and our gradient fields. And we use those to create the MR image. All right, so now let's take a look at some basics on MRI safety, okay? You want to consider that if there's an MR system present, just take the case that the magnet, that main magnetic field, is always on, okay? Everyone that is going to enter into the system room where the magnetic field is located must be screened. In fact, it's recommended that they be screened before even coming into the control area, and because it's too easy if they're in the control area for someone to perhaps just wander into the system room, okay? So it's very important that any and everyone, doesn't matter if it's a physician, doesn't matter if it's a patient or a technologist, radiographer, some ancillary personnel, maybe someone with anesthesia or someone from housekeeping, anyone that is going to enter into that system room must be screened. And what we're screening for is biomedical implants, to determine if it's safe or if there are specific conditions that we need to follow, if there's a biomedical implant present. We're also looking for any items, surface items, that could become projectiles. So we'll do like a medical screening where we're going through and getting the patient's history or the individual that's coming into the system room's history. Okay, their medical background, and then also a physical screening to look to see if there are any items that might become potential projectiles. Okay. Now, the great news with MR using the limitations that we have thus far is that there are no lasting biological effects when it's used properly. We can become deadly when used improperly, right? If there's a projectile that may unfortunately cause trauma, that could become a deadly incident, okay? But again, when we use the MR system properly and we practice proper MR safety procedures, then there are no lasting biological effects. And so that makes us one of the safest modalities, again, when we're used properly. Okay. Now, that said, when we're used improperly, the three most common reported injuries to patients would be first and foremost burns, because those radio frequencies do deposit a lot of heat into our patient's body. Okay, so when that when the system has calculated based on the magnetic field strength and the gyromagnetic ratio of hydrogen, that's a real fancy constant, don't worry about that, but just know that the software of the system is doing that calculation constantly and determining what radio frequency pulse it needs to send out so that it will cause resonance in the patient's tissue. And when that energy, that radio frequency energy, is absorbed by the patient's tissue, then that causes heating. And so once again, we must use our equipment properly to ensure that our patient does not end up with a burn. If, for example, I believe in this case, this patient's skin was touching the side of the system, okay, touching the bore of our system without proper insulation. And so that resulted in a lot of heat accumulating in that location, and the patient sustained a burn, sustained that injury. So we avoid burns by ensuring that there is at least a centimeter of insulation between our patient's tissue and our system equipment, whether that is the coil that they're positioned on to capture their signal that's coming back, because they do give us a radio frequency signal back from their body, and that's how we get our image. Okay, or whether there's any contact with the side of the system, or for example, if there's a lead to do an EKG tracing, etc. So we want to make sure that everything is properly positioned with the proper amount of insulation. If there are any kind of cables or wires coming back to our medical equipment, we need to make sure those are straight and that there are no loops so that we don't induce a current and have our patient sustain a burn. So that is the number one issue for MR safety. Again, that is always preventable when we are practicing properly. Okay. The number two concern for our patients is projectiles. So anything that is ferromagnetic and gets within a certain proximity of our system can become a projectile. If you were to take a paper clip, for example, into a system room with a 1.5 Tesla scanner and let that paper clip go, that paper clip would reach a terminal velocity of 40 miles per hour. I apologize, I don't know what that is in kilometers. I'll have to look that up. So anyhow, 40 miles per hour, it goes very fast. You don't see it come off of the paper. You just hear it hit the side of the system. Okay. So projectiles, even if it's a small object, can be very hazardous. And of course, that's the number 2 concern for our patients. It's the number 1 concern for MR radiographers. Okay, so we need to be diligent in performing our physical screenings to ensure there's no objects that are ferromagnetic that are entering into the system room. Okay. And then the number 3 issue that our patients experience is hearing loss, because when our system is activating those radio frequency and gradient hardware components, they do shift around inside of the gantry of our system and they make quite a bit of noise. And so we need to ensure that we give our patients hearing protection. So that could be earplugs, it could be noise cancellation headphones, it could be a combination of both of those. But again, this is preventable. Okay, so again, MR is very safe when it is used properly, but it can be very unsafe very quickly when used improperly. Okay, so moving on, I want to share about our relaxation processes. So I mentioned that resonance happens when the system transmits a radio frequency that matches the rate of precession of the hydrogen nuclei. And when that happens, those hydrogen nuclei absorb all of that radio frequency energy and they get excited and they tip away from our B0 field. So you can think of it initially as though they are aligned together and both pointing, say, at 12 o'clock. Okay, so if this is my, let's say if this is my magnetic field for my system and this is the magnetic field for my patient, when that radio frequency is absorbed by the patient's tissues, it's going to cause their spins to turn away from their hydrogen nuclei, to turn their alignment away from B0. And when it gets in that transverse plane or perpendicular to the B0 field, now our computer system can distinguish the patient's magnetization and the signal that's coming from the patient from the systems. Okay, and of course that's important because if they're just superimposed on each other, then it's not going to provide us any useful information. So let's take it back to our slides. Okay, so T1 relaxation, there's 2 types of relaxation processes, T1 and T2. And T1 relaxation is going to happen when our system, or excuse me, when our patient's hydrogen nuclei realign with that B0 field or the longitudinal magnetization. Okay, so about 63%, when 63% of the patient's magnetization has realigned with our main magnetic field, that is our T1 time. Now that's important because it's different for every tissue. It's different for fat, it's different for muscle, it's different for bone, it's different for fluid, and that's what gives us different image contrasts. Otherwise, we would just be looking at just all white in our image, and that would not be useful. Okay, so we need to allow these relaxation processes to occur so that we're able to distinguish different structures within our patient, different tissues within our patient. Okay, so T1 is one of our relaxation processes. The other one that's happening simultaneously, but it's a separate process, is called T2 decay. So we have T1 recovery and T2 decay. T2 decay is where we lose 63% of the magnetization in the transverse plane. So remember, we started with our patient. Let me stop the share so you can see my gestures here. So we started with our patient in our B0 system with a longitudinal alignment. Then we turned on the radio frequency, which caused the transverse alignment or the perpendicular alignment between the patient's magnetic field and the systems. Okay. And so when we turn off the radio frequency transmission, that magnetic field is going to shrink along that transverse axis. It's going to get smaller and it's going to regrow along that longitudinal axis. All right. And so that is our two different relaxation processes, our T1 and our T2 relaxation processes. Now, those are tough concepts, so if that's not making perfect sense for you, that's okay. Just know that those are going to contribute to us creating contrast in our structures, okay? All right, now let's take a look at our parameters. We have a couple different sets of parameters that we work with in imaging, and this is true of X-ray as well as for MRI, right? When we think about X-ray, we can talk about the Z number of the tissues or the atomic number of the tissues and how much they're going to attenuate the X-ray beam. Are they going to be a radiopaque tissue or a radiolucent tissue? That's going to be an intrinsic parameter when we're talking about X-ray. Okay, and when we're talking about an extrinsic parameter, that would be things like what is our source to image distance? What is the KVP that we're using? What MA? What time are we using? Okay, so those would be the parameters that are extrinsic or external that we are manipulating. So we have the same concepts with MRI. We have intrinsic things for our patient's tissues. That's going to be, for example, our T1 recovery that we just discussed, our T2 decay. Another intrinsic parameter would be our proton density. There's a lot of hydrogen protons. For example, think about brain tissue versus lung tissue. Which one will have more hydrogen protons? So our brain tissue is going to have a lot of hydrogen protons. Our lung tissue, not so much. So we would have differences in our image appearance because of that difference in proton density. Okay, other things that are going to come into play would be flow of cerebrospinal fluid, flow of blood flow, whether it's arterial or venous, even lymphatic flow. Okay, then there's diffusion. Diffusion is just the random motion of molecules. And perfusion being the amount of blood that is brought to a region of tissue, or the grams of blood per centimeter of tissue. Okay, so those are all intrinsic examples of intrinsic parameters. Those are things that are inherent to our patient, and we don't have control over them, not directly. We have indirect control over them through our extrinsic parameters. And so these are the parameters that our technologists and radiographers are adjusting at the console. We're setting the TR, the TE, the flip angle, how many times we go through and collect the signal, or our number of signals that are averaged. And then a few others there. So I won't dig into those too deeply since we're just going through the basics. But, you know, as I mentioned, we need those radio frequencies to create resonance. So TR is going to be a measure of time, or a time interval in between each of those radio frequency pulses. So we get to adjust what that time interval is, and that is going to impact our image contrast. And of course, contrast is just, you know, differences in shades of gray. With MRI, where we end up with our differences in shades of gray is because we have differences in signal intensities. So where we have a very strong signal intensity coming back from our patient's body in MRI, that would be white in appearance. Whatever the strongest signal is, the system reconstructs that area as white. Whatever the weakest signal is, the system reconstructs that area as black. Okay, and then whatever signal intensities we have in between give us our shades of gray. So if we have very high contrast, we just have black and white images. If we have lower contrast, we have many different shades of gray. Okay. And so image weighting in MRI is going to be about which type of contrast. We talked about our T1 and our T2 relaxation processes. those both give us two different kinds of contrast. And so we get to, through our extrinsic parameters, adjust the weighting, adjust which type of contrast our image skews toward. So those intrinsic parameters, all of those things are going to be present or contributing to every one of our images. But again, through our extrinsic parameters, we get to indirectly say, okay, let's have that skew toward T1 contrast, and that would create a T1 weighted image. Or let's have the image contrast skew towards T2 contrast, and that would give us a T2 weighted image. Now, we want those differences in image weighting because our radiologists are going to review those images for different patterns that are going to be associated with different pathologies. And so a general rule of thumb is that we'll do T1 weighted images to demonstrate anatomy, and then T2 weighted images to demonstrate pathology. Okay, and so that begs the question, well, what do all of these images look like? So here's some T1 weighted images. We see a brain and a spine and a knee. Typically, these are going to have very bright fat signals, so very hyper intense fat signals, and then very hypo intense or low signals from fluid, from cerebrospinal fluid in the ventricles, and the cerebrospinal fluid in the spinal canal. There's a bit of edema here in this patient's knee. And so that is the appearance of T1 weighted images. And you can see that the T2 weighted images have a very different appearance. And so now we have very hyper intense signal or high signal intensity from the fluid. And again, we're seeing the CSF and the spinal canal and the ventricles. There's a partial tear of this anterior cruciate ligament here in the knee, which we see from the fluid collection there. This should be solid black like the posterior cruciate ligament. And because we're seeing that hyperintense signal there, we know there's a partial tear. It hasn't completely torn away from the bone there. Okay, and just a side by side. So here's a T1 brain and a T2 brain. So we have T1 on the left and T2 on the right. And then the spine, T1 again and T2. And our knee, T1 and T2. Again, you got to look closely to see where those fluid accumulations are here in this anatomy, but they are there. We do see those clues from the fluid. So that wraps up our talk. We have talked about those three energy fields used in MRI. That's our B0 field, our radio frequency field, and our gradients. We talked about the fundamental steps for creating MR images, the basics for MR safety. And remember that we want to consider that anytime we're in the MR environment, that the main magnet is activated and on, and therefore be very judicious and careful in not bringing ferromagnetic materials into the vicinity of that system. Okay. And then our relaxation processes, there's two relaxation processes, the T1 and T2 relaxation. Those are a couple of examples of intrinsic parameters that are inherent to our patient's tissues. Every tissue is going to have a different T1 recovery time, a different T2 decay time, which we manipulate those indirectly through our extrinsic parameters at our console to create images with different weightings where we've skewed them toward one type of contrast over another. So again, thank you for having me and allowing me this opportunity to share more about MRI with you, and wishing you all very well. I hope you've enjoyed the talk.